food allergies, but they may be wrong. Dr. Richard Chaffoo joins us now to explain why. So there's this new study out there, and what did it say?
So Heather, it was this fascinating study from Northwestern University, and they interviewed 40,000 American adults, and they asked them, do you have a food allergy? And food allergies, they found that of the 40,000 people, half of those people really didn't have food allergies when you drilled down. You looked at what are the symptoms of food allergies. As we all know, serious symptoms of food allergies are life-threatening. For example, you could have a problem breathing called anaphylaxis. You could have a bad rash. You could have significant swelling or vomiting. And when they eliminated those symptoms, when they looked at that whole series of people, half of those people that responded to the survey actually didn't really have food allergies per se.
Well, and a good example is people who have maybe a sensitivity to gluten, and then people who actually have celiac disease, correct?
Exactly.
I think a lot of people think that they have a gluten allergy, and what you're saying now is it's really just a gluten sensitivity.
It is, and there's an important distinction between that. I think what's happened also, Heather, is there's more awareness to the public. If you think of all the foods that are out there now that are advertised, it's a multi-billion-dollar industry talking about foods for people that have food intolerances. I think it's heightened our awareness, but maybe it's just not an accurate description.
So why do people think they have these food allergies? What's going on with them to make them think that?
So what they're thinking, they're confusing true anaphylactic immediate responses, which are immune responses, to feeling just a little bloated or a little nauseated, and they're saying, well, clearly I have a food allergy, when it's truly not. It's more of an issue with your GI tract or digestive system versus a true food allergy is related to our immune system, where it's an immediate IgE response.
Right, and I mean, people who have sensitivities it's not wrong, right?
No.
Like, they can say that I'm allergic to something because it truly will mess up their stomach. I think the big problem is the self-diagnosis, right? The Googling.
Yes, exactly.
What should these people do then? And why does it matter if someone is actually diagnosed with something or if they're just sensitive to something? Why does that matter?
So that's a great question, because it matters because true food allergies can be life-threatening.
Right.
Not only in children, but in adults. Whereas a food sensitivity, as you said, can just be more of an inconvenience. So what should people do? If you're not sure, it's best to get to your physician. Your family physician can either evaluate you or refer you to an allergist, where they can do formal testing to, number one, maybe rule out that you don't have an allergy, but more importantly, maybe to find out what is going on, if there may be some other factor that you have a true allergy to that you should stay away from.
Right, I know some of the most common allergens are shellfish, milk, peanuts.
Yes.
Peanuts is a big one for kids, a pediatric, and then, but when we talk about gluten and all of those other allergies, how can you prevent it? So with someone who has a sensitivity, is there a way that they can maybe come back somewhere to censor? Like, if you had a gluten sensitivity, is there something you can do to maybe eat gluten again?
So that's a great point, and researchers are still looking at that point, because we think if early on you're challenged with something in small amounts, perhaps you won't have that sensitivity as much. In fact, the American Academy of Pediatrics just reversed a policy statement. They used to say, don't give children any kind of nuts before the age of 3. What they found in this study was that there's research evidence showing that if you've actually had eczema, or you have some severe problems of that nature, you can actually introduce peanuts at the age of 4 months.
Oh, wow.
And that may actually reduce the chance of a life-threatening allergy. Now, it's not something done on a regular basis, but evidence seems to point to what you earlier said, and that is that if you introduce something early in a smaller amount, it may actually prevent you from getting a significant allergy later on.
Well, and really smart people and really great places, especially UCSD and a lot of our medical centers here, are doing some great work to get people who have these sensitivities and allergies, small doses, like introducing them back into their diets. And there is a lot of stuff out there that's working right now. So I know you know a lot about that as well. I wish we had time to talk about it, but it's a whole other can of worms. Final recommendations for people who might think they have an allergy or think they have a sensitivity and maybe want to make that change in the new year, maybe change up their diet or do something.
And that's the critical point. So if you're not sure, then there is a difference, as we've said, between a true allergy and an intolerance, if you will, to a food. It's best to get in to see your physician, talk about this, and make the appropriate recommendations to see an expert to get treatment.
Yeah, those tests can do so much for all of us. All right,
definitely.
Dr. Chaffoo, thank you so much
Thank
for
you,
being
Heather.
here. All right, Raul.